Okay. The patient's name is Janet, and she came to my clinic with the chief complaint, number 5, laminate broken. So she filled out the forms. I'll be sitting in my office, checking her medical dental history, and there's nothing being checked in medical dental history. That's normal, okay? So when you see these cases, when you see especially this case, what do you have in your mind? Okay, why did number 5 laminate chipped? What's the reason? Okay, how can we solve the problem? Just regular case. Every one of us clinicians, if I see the case, I go ahead and start doing laminate or debonding if it's an emergency patient. But see how I'm going to approach this case. So when I walk in and ask Janet, how did you break this number 5 laminate? She said, I don't know. Okay, it just happened. So the next question I usually ask, if this is the first time you broke this laminate? I said, no. This is already the 3rd time I'm trying to fix number 5 laminate. Okay, I already have a red flag. What's gonna make me different from another clinician so I don't have to repeat the same problem? When you restored laminate, was it part of this full mouth rehabilitation case? I said yes. Okay. Let me ask you, did you have any problems with those restorations? She said yes. I did this laminates a year and a half ago. In each one of them, I have to resubmit or redo 2-3 times already. So I have more red flags. You see, the patient didn't put anything in her dental history. Because most of the time what patients do, they just lounge release, they check yes or no, because nobody pays attention anyway. But I have to go and ask the questions, so that's why we have to direct the questions. What usually happens to those patients? So Janet, I see you have a space here between 8 and 9. Okay, I'm sure it's that when the dentist placed those restorations, you didn't have them. I said yes. Did you develop that space after the placement, the restoration? I said yes. Is it getting bigger? I said yes. You see what I'm trying to say? I'm trying to get more information about these patients. How can I probably avoid the problem and solve the problem? Because if I'm going to restore number 5, I just fixing the aesthetic part of it, but not functional part of it. I didn't solve the problem. So the patient says, I found you on Google, you have good reviews, and I came to you probably to solve the problem. So I need to get more information about this patient's emergency patient, okay, between the patients. So my next picture, and I want you to look all in here. I said, Janet, I see you have wear on the bottom of your teeth. Okay, yes. Did the wear on those teeth got worse within 5 years? So what it means to you, if it's getting worse, it means something is active and the bite is not stable. Do you understand what I'm going to? So I'm getting more and more information about this patient. She said yes. Okay. So my next question was, the reason did you have this restoration in the first place? Why did you place them? She said, I have worn teeth. Okay. I've been doing some cosmetic work, the bondings. The bondings didn't stay. So my dentist offered me to put something stronger. Sounds familiar? Okay, I'm gonna put porcelain. Okay, and the porcelain is gonna stay and probably solve the problem. But we already see it's from the patient's history that the cosmetic case was solved, but function is not. So I'm asking her, it's, John, do you have any problems eating soft food or hard food? She said, yes. Okay, I can't eat for a long time. My muscles getting tired. Okay, I said, do you have problems eating steak? Simply you have to cut in pieces, just to chew properly. She said, yes. But you see, it's everything what she was saying in dental history, but there's no check. I already know a lot of information about this patient. So besides that, I want to ask you, do you have migraines, headaches? Okay, do you have any problems with that? She said, yes. Okay. So the next question would be, did you speak to your dentist? Did you speak to your physician about any problems you have? Okay, do you have any medical conditions? Okay, she said no. Okay, I just went and fixed those teeth and now I'm having problems. So for me as the dentist, I want to make sure I find the reason the patient has a problem. So I said, you know, I need a little bit more information about you. I need to collect the data. Okay, most likely your bite is a little bit restricted. Okay, and why did I chose the restriction? Because I ask you another question. When you bite, do you feel your lower jaw pushed back when you bite? She said yes. Okay, that's the reason she has a diastema between the front teeth, and chipping, breaking, and wear. Okay, so you see it's guiding the patients in the right direction, asking your questions, okay, give you a lot of information.